Are you struggling with finding solutions to your mental health issues? I may have a novel solution for you. Hi, I'm Dr. Norris Goldberg. I'm the owner and clinical director here at Koru Chiropractic Corrective Care, and my specialty is NUCA, which is the National Upper Cervical Chiropractic Association. And it's a lot different than traditional chiropractic care. And I'm gonna explain a little bit more about that, but first I wanna show you the connection between your mental health and your spinal alignment, okay? When you get a misalignment at the top of the spine, right here, the atlas bone, C1, C2 axis as well, when you get a misalignment, it causes a lot of neurological issues. A lot of times people experience these issues as headaches, neck pain, migraines, vertigo, dizziness. And the thing is, we get great results with that. But what I've seen over my years of practice is that sometimes people will report changes to things that we didn't expect, like their mental health, because there's no special adjustment to help with things like depression or anxiety or bipolar disorder. But what I've found is when we get really good upper cervical corrections, not only do people feel better, they're ultimately just functioning better. And that's the connection between the spine and mental health is your nervous system, right? Because if your nervous system is not functioning properly, your blood flow is not functioning properly, your whole body, hormones, metabolism, everything can be out of whack, okay? And so having a misalignment of the spine directly can affect the brain as well, because especially at the top here, these are where these arteries are coming, your vertebral arteries through the back of your neck, out the bones, and then to the back of the skull. Well, if you got a big kink in your neck, you're not getting adequate amounts of blood flow. And a lot of times, again, this results in a symptom like vestibular disorder or migraines or even just neck pain, right? And so, you know, for people, if they said, hey, well, I have bipolar disorder and I don't have any of those problems, I would say I'm probably not the right person for you, right? But if you've been struggling with mental health and you have a lot of physical issues, especially up in the neck, that may be a disconnect that is causing some of these mental health issues to just be exacerbated. So especially if you've tried a lot of their traditional approaches, you know, like cognitive behavioral therapy, maybe you're having to take medications, supplementation, exercise, all those things I totally endorse if needed. But sometimes people are saying, you know, I'm just not seeing those results, or I don't want to take these medications and I just don't understand why I'm feeling this way. It doesn't feel like my normal self, right? And sometimes we can even tie it back to maybe an injury or a trauma, like an accident. And then all of a sudden after that, they had things like anxiety or depression. And so what we do is by correcting the spine and improving the structural alignment of the spine, we can restore the function of the nervous system. We can see improvements to things like, again, blood flow up into the head and really throughout the whole body. We see improvements to cerebral spinal fluid flow. That's been shown through research doing special advanced imaging using phonar MRIs before and after upper cervical adjustments. We can see more regulated cerebral spinal fluid flow. And that's an important part, both the blood and the cerebral spinal fluid, because that's how we're getting all the nutrients to the brain, but also getting all the toxins out of the brain, right? And so if those are congested or backed up in any kind of way, you may be experiencing a dysfunctional physiological effect in your body that is caused by a structural issue, all right? And so like I said, if you have a mental health issue that, you know, maybe is, you know, not associated with any physical problems at all, you got a history of some trauma or something that may have brought those mental health issues on, then that needs to be dealt with in its own realm. And that's I'm a big advocate of psychotherapy and, again, medicine if needed. However, again, if you have a connection to your mental health, or there may be a connection to your mental health and things like your chronic migraines and, again, maybe a vestibular issue like vertigo or just dizziness or orthostatic hypertension, those are issues that do respond to upper cervical chiropractic care. And I've had patients tell me that their anxiety is completely resolved. They've taken themselves, with the direction of their other providers, taking themselves off medication. I've had people who were stable on their medications for things like bipolar disorder and getting adjusted changed so much in their body besides just how they felt, those aches and pains, but really the whole function of their body, that they had to actually change their medication prescription to keep that bipolar condition more regulated. okay? Because all of a sudden it was too much medication, their body was functioning better, they didn't need as much, right? And so we always do those changes, co-managing it with a medical provider who does prescriptions. That's something as a chiropractor we don't mess around with at all. But when it comes to getting specific corrections to the spine and using actually very gentle adjustments to realign the top of this neck, we're not doing any twisting, cracking, or popping up here, but with gentle NUCA adjustments, we can get these bones back in place, literally get your head on straight and restore the function of your nervous system, and really, again, not just get you feeling better, but functioning better. So if you think you may be dealing with this issue, give me a call. We'd love to consult with you, talk about what's going on, and if it seems like it's appropriate, we'd invite you to come in for an initial neurostructural testing where we can evaluate your whole spine and nervous system, see exactly what's going on and how it may be connected to your conditions. So if that sounds of interest to you, give us a call or drop us an email, and hope you're having a great day. We'll see you soon.